Here's how the VA rates the wrist, and this one is super simple. So the majority of wrist VA ratings are based on range of motion, and as you can see here, 10% is what you get. You cannot have a rating for both Dorsey and Palmer. It's just one or the other. So long story short, 10%. There's another rating for the wrist, which is pain with motion, that is also at our illustrious 10%. That one killed me there. If your wrist has been replaced, you can have a rating of 20, 30, and 40%. And you see the dominant and non-dominant criteria here, and a temporary rating of 100% following the replacement. And that is going to need its own video for its own explanation. And for the most severe wrist conditions, which would be the loss of use, this is where your wrist can have a rating of anywhere from 20 to 70%. And again, you can see the dominant and non-dominant rating criteria here. And if you have if you don't have a wrist, okay, your wrist is no longer part of your body, you can see the dominant and non-dominant ratings here at 60, 70%. And if you don't have any hands, that is 100%, and under the loss of use or amputation. So both of these schedules, you are entitled to special monthly compensation. It is important to note that veterans can and likely have carpal tunnel or cubital nerve damage secondary to that wrist condition in your hands, and that is generally a pretty easy secondary to get service connected.